Good morning. I'm Dr. Claytor Noone Plastic Surgery. I'm here with Mara, who's our excellent front desk receptionist, and we're talking about the new beauty magazine. If you're interested in facial rejuvenation, you should really be getting a copy of this. It's a great resource, helps answer a lot of questions that you're going to have. We're going to go over some of them today. One of the topics in here is what really happens when you get a facelift. And you can see it looks just like this. And so they go into all kinds of basics and talk about the different kinds of facelifts. So let's talk a little bit about them. Somebody comes in with concerns about facial aging and facial atrophy. They'll call on the phone and they'll say, I'm really interested in getting rid of these wrinkles, and I've been told that all I need is some filler. But I've been doing this for 5 years with fillers, and I still don't feel that I've achieved the look that I want, and I feel like I'm wasting my money. And to that we say, you might be. Fillers are great, and they have a real place in helping women look younger and have that rejuvenated look with virtually no downtime. But if you want to improve the jowls and tighten up the neck and raise your cheeks and give yourself that erase all those wrinkles, then you really need to think about the next step. And so in the beginning we talk about fillers, we talk about Botox, we even talk about different lasers that we have, and even Pellevé, different things that we can do to erase some of the wrinkles. But when you've gotten past that, when you've gone through that period of time and you're looking for that more robust rejuvenation, then we start talking about surgical procedures. And starting from the neck and moving up, a lot of people will say, you're as old as your neck. You are as old as your neck makes you look. And unfortunately, it's the happy people. The people who really animated are the ones that get the greatest injury to their neck because they're pushing and pulling on all those neck soft tissue, and that's what causes the wrinkling. And so there are a couple of maneuvers. One is to do a simple neck lift. So if you have skin that's stretched, then it needs to be tightened. And so incisions up behind the ear, a lot of times I'll make a small incision underneath the chin and do some gentle liposuctioning. I'm not a big fan of taking those platysma muscles and pulling them together. It used to be very big when I did my cosmetic training back in New York 15 years ago or so, and people would go in and they would open the neck and make a big incision here and go in. The problem with that is that when you take those platysma muscles and you pull them together, you can get bunching of the skin underneath here, which can be very distressing. And what people really want when they come in, they go like this. I want to go like this. So the platysma muscle has no function for moving your head or speaking. As in a horse, the horses use it to move their head. But in the humans, the platysma muscle is nothing but a expression muscle. And so we can pull on it and tighten it laterally, which is really, most people don't come in and go, I want you to tighten my neck like this, right? They go, I want you to tighten my neck like this. So we take the platysma here and we take sutures and we anchor it on the mastoid fascia back here, and we laterally pull, and that takes along with it the skin. So there's very little tension on the skin when you're pulling. When there's very little tension on the skin, then you have results that have less stress on the scar. Less stress on the scar can ultimately result in better scars. And there are a lot of little maneuvers that we can do for the scars to minimize scar formation, but that's one of them. And so we like to call that the neck lift. Now there are some people who have really big, heavy, thick necks that really aren't going to benefit from just that procedure alone, and there we start introducing what we call the hybrid neck lift, and that's where we make a small incision here and here and here, and we go in with our laser, which is the 1440 nanometer laser that has side firing. So in the beginning we go in and we fire down into the deep tissues, and you'll hear it go, and that's popping and snapping the fat, rupturing the fat cells. Then I come in again with liposuction and suction out all that fat. In some patients that's all you need, and that can be great, and they can be very, very happy with that. Just liposuctioning that area. those are patients that might otherwise come in and be asking for Kybella, which is the little fat melting from Allergan. Great product, and in the right patient, fabulous product. More often than not, people want a faster result and want something done more expeditiously, and that would be the Precision SmartLipo with a small incision here and here. We go in, break up the fat, and then we suction the fat out, and then I come in again, side firing, and I turn the laser up to the skin. So it's pointing out to the skin, and it's melting the fat just underneath the skin. And what does that do? It causes tightening of that tissue, and it really tightens it. And in the right patient, it's a phenomenal procedure. Wear a tight neck band, a little bit of bruising, and they're back at work, within a day or two. And virtually nobody knows what's going on. It's really quite dramatic. For the next patient, there was a little bit of extra skin down there. We need to do the hybrid facelift, and that's the same procedure with the Precision SmartLipo from Cynosure, but then we make a small incision behind the ear and we redrape that tissue. We lift on that tissue, we grab the platysma muscle, we take it back and we anchor it to the fascia on the mastoid, and that helps redrape the neck, and then we take out that little bit of extra skin. And it's really great because it doesn't leave you with that telltale scar out in front of the ear and in the sideburn area. And that's very popular because you're as old as you look on your neck. And if you could make your neck look younger, you will look younger. So then moving up, a lot of jowling. If people have jowling and they don't like it, try this at home. If you have jowling and you don't like it, take a hand mirror, sit, look like this, and then lay back down and look at your face again. If you like how you look, you'll love a facelift, because that gravity right now is pulling down. When you lay back, that's the gravity forces moving in the same direction that a facelift will give you, and it will remove those jowls. For those incisions, we like to come up just behind the tragus here, right in front of the ear, and then just right a tiny little swoop right underneath the sideburn here. Now some patients we go up here to if you need a more of a lift into the malar region. In that case, we take the platysma muscle and we have it here and we anchor it into the temporalis fascia here. And that gives us that vertical lift on the neck. Okay, so we're still, a lot of times with a full facelift, people don't realize this, but you get a neck lift at the same time. So there's neck lift alone, and then there's full facelift, which involves tightening of the neck. And you grab that same platysma muscle and you elevate it up and you anchor it to the temporalis fascia here. So now you're getting a vertical component, which is great because what's been happening all this time? Gravity's been pulling down. So this turns around and pushes it back up. Then also, a lot of times people they're malar eminence because they smile. Again, it's the people, the happy people, they have the greatest trouble. They have the greatest trouble because their malar eminence, they're pushing back and forth, and what happens? As we age, our bone atrophies. Our bones in our face atrophy, and as our bone atrophies, we lose that scaffold. You ever heard the saying, beauty is only skin deep? Well, that's not true. Beauty is actually bone deep. That facial structure is what generates that aesthetic look that we all have. And so as we age and that bone atrophies, the malar eminences fall off of it. In addition, people who smile a lot, they're the ones who are pushing and pulling on the zygomatic muscles, and therefore they wear down all that elasticity and the malar falls down. So when we do a facelift, we go in and we take this malar mound here and we resuspend it again up to that temporal fascia. So we're not only improving the neck, we're not only improving the jowls, we're taking the malar mounds and we're resuspending them, not just in the vertical, but here in the vertical lateral. So we're resuspending that, which actually can be very good for the tear trough area as well. Frequently we'll use a small drain that'll come out the next day, and then sutures, tiny little sutures meticulously placed after the excess skin is removed to close the wound. Whole operation can be as short as an hour and as long as 4 hours, and it's customized to every single patient. And in the right patient, we can do it here under local anesthesia in our Quad ASF surgical facility, or at the surgical surgery center where it's an outpatient operation. You have the operation, you get to go home. Or some people choose to come from great distances, and we'll spend the night, and they'll stay overnight in the hospital. They love it. The nurses are fabulous at the hospital and dote on them, and they're great. Then I see you in the morning and take the drains out, and then you get to go straight home. So there are a tremendous number of options. You can go from the most minimally invasive type procedure, which would be the precision SmartLipo, all the way up to the full facelift. And it's really customized based on the patient's concerns, the patient's anatomy, and their timing. Some people say, look, my daughter's getting married in a month and I need to be ready chop chop. Other people say, look, it's the middle of winter and I want to be ready for the summer. We need to do the works. And so we can customize it for whatever works for them. And it just doesn't end after surgery. After surgery, you have the patient come back the next day. We have our whole team work with them. We get you plugged in with our esthetician to make sure that you're getting great postoperative care. Sometimes people benefit from a little Pellevé treatment to help smooth out some of the postoperative edema, and patients often are very quick recovery. The majority of the patients are able to be out and about without a scarf around their head within a week, and can get back to regular activities such as working out by maybe 3 weeks or so. Full duty, and I like to say that's like playing tennis. That might take a month before you get to that part. So that's our review of facial plastic surgery. And if you have any questions, we're more than happy to answer them. You can call everyone in the office as an expert about talking about these different options. And then really the best thing to do is to come in and have a consultation where we can go over your photographs together and talk about what fits best for you. Thanks again for joining us at Claytor Noone Plastic Surgery.